Hi, my name is Bree, and welcome to my presentation. We're diving into the U.S. healthcare system's top challenges and exploring potential solutions. So stick around, it's a conversation we all need to have. The U.S. healthcare system is a complex web of policies, people, and practices. While it offers some of the best medical advancements globally, it also struggles with key issues like price transparency, physician shortages, and access to primary care. Today, we'll break it down and look at ways to create a system that works better for everyone. First up, price transparency, or the lack of it. Imagine going to the store and having no idea what your groceries will cost until you go to check out. That's what patients experience in healthcare. Prices for the same services, like an MRI, can range from $400 to $4,000, depending on where you go. This makes it hard to plan or even access care. Regulations like Hospital Price Transparency Rule aim to fix this, but enforcement has been spotty. Um, we need stricter rules to empower patients and encourage fair pricing. The fee for service model pays doctors for every test or procedure, which sounds fair, right? But this approach often encourages quantity over quality, which means higher bills and unnecessary treatments without better health outcomes. Some solutions like value-based care focuses on patient results instead of how much is done. Programs like bundled payments are already showing promise. It's time to rethink how we pay for healthcare. Next is the growing physician shortage. By 2034, the US could be short up to 124,000 doctors. Rural areas are hit the hardest, leaving many without basic care. And training to become a doctor is expensive and time consuming, which pushes new grads toward higher paying specialties. We need more residency spots, loan forgiveness programs, and incentives to attract doctors to underserved areas. Here's a big debate: single payer versus multiple payer systems. A single payer model simplifies healthcare by having the government cover costs for everyone, like in Canada. A multiple payer system, like in the US, relies on insurance companies and offers choice, but at the cost of complexity and inequity. But a hybrid approach could bring the best of both worlds, streamlining access while maintaining innovation. Let's talk structure. A centralized system, like the UK's, ensures equal access and controls costs, but they can limit flexibility. The US, on the other hand, uses a decentralized system where states and private companies handle the healthcare. While this allows local tailoring, it creates disparities. But countries like Germany use hybrid systems to balance flexibility and fairness. Maybe that's a model we should explore. Primary care is essential for prevention and managing chronic diseases. But why do we have a shortage of primary care doctors? Why? They earn more than specialists and face heavy workloads. The result? Patients wait longer, they travel farther, or they skip the care entirely. Expanding the roles of nurse practitioners and physician assistants could ease the crisis while training more primary care doctors. The free market model thrives on competition and innovation, but leaves millions uninsured. The social model offers universal care funded by taxes, but limits choice and can face delays. The US blends both, but also needs reform. Imagine a system where innovation meets universal access. That's the goal. The US healthcare system has so much to tackle, like pricing, physician shortages, primary care access, and systemic inequities. But solutions exist, and with the right reforms, we can create a system that works for everyone. Thank you for watching my presentation. I hope you learned as much as I did about the challenges in the US healthcare system.